Okay, again, page 70 talks about cancer, which is associated with excessive cell growth. And here it shows a picture. Here it shows a picture of what cancer cells look like under a scanning electron microscope versus what normal cells. These normal cells have little cilia on their ends.
Silly.
That can trap particles. But these cells are don't have the shape, the characteristics of normal cells. That's because cancer cells kind of go back to an earlier stage of cell formation when they form. What's the word used for going back to this earlier stage of cell formation and not looking like the cells that they're supposed to look like? There's a word that we learned. Do you remember?
De-differentiation.
De-differentiation. Thank you, Queen Catherine. De-differentiation. So we learned all 5 of these words. Hyperplasia, cells multiplying, out of control. De-differentiation, they go back to what? To a form that doesn't resemble the cells, the adult cells.
So is it like an initial form that they were before, or do they take on like a new form that?
Well, it's the initial forms of the cells are de-differentiated too, so they take on that de-differentiated look that the original form of cells have. Although there's probably some differences about them too. Invasiveness, what does that mean?
Like break through the boundary.
Can break through the various membranes and such in the body and spread throughout the body.
That's when it becomes...
And I'm kind of going back over this in part for Polly, who we forgot to record for. But
Sorry,
and anyone else who wasn't here for this. And so again, if we watch this video, we see a cancer cell form. See that brown cell? That's a cancer cell. And it grows into, what do we call this big mass of cells? That's a tumor. And the tumor can break through its basement membrane if you let it go long enough. And then the cells can get in the bloodstream and travel. End up somewhere else in the body, growing into more tumors elsewhere in the body. You don't feel this when it's going on. It's happening inside you, and there's not a lot of way to feel it until the tumors get so big that they start pressing against nerves or blocking normal functioning or breaking through membranes and causing bleeding and such. Often that doesn't happen until a much later stage. My aunt had a little bit of back pain, and that wasn't going away, and she went in and she had cancer everywhere in her body, just spread out. She was dead in a month, maybe. So that's one of the terrible things about cancer is you often don't know it's happening inside you. Many people with spreading cancers feel just fine for a while. There's another thing cancer cells have that normal cells don't. Cancer cells don't have what's called contact inhibition. These are some normal cells growing on a plate. Let's listen to it.
Normal mammalian cells growing on solid medium stop dividing when the expanding clones of cells contact one another. This is the phenomenon of density-dependent inhibition. Cancer.
Okay, so what they've done is they've put some cells on a lab dish, and as long as you feed the cells nutrients, they'll multiply and spread. But when they're touching each other, they stop multiplying. We have a name for that. It's called contact inhibition. Contact inhibition. That's when cells are touching each other. and when one cell touches another, they somehow signal one another to stop growth, stop cell growth. And so these will all stop growing at that point. And that's how, like when you cut your skin, the cells grow back over and then stop growing.
Do you think it has to do anything with layers?
It has to do with proteins on the membranes of these cells. There are proteins that when they come in contact with other cells, they send a signal to the nucleus and tell it not to multiply. Now, cancer cells don't show contact inhibition. So let's continue the video and they show you what it would look like if you were growing cancer cells in this plate.
Of density-dependent inhibition, cancerous tissue, lacking this mechanism, grows without limit.
So there's cells growing on top of other cells. They keep growing, you see. They don't stop. So that wasn't that great of a video, but that kind of gives you an idea. Cancer cells will look different in the plate than normal cells. The other two words page 70 wants us to know are angiogenesis. Do y'all remember what angiogenesis meant? Anyone? Bueller?
Extension of the blood vessels?
Yes, growth of blood vessels. So, if this is an arm, somebody's arm, that's a hand. I'm a good artist, aren't I? And you have this growth, which there's your tumor, and there are blood vessels going underneath the skin. The blood vessels will grow into the tumor, you see. And angiogenesis is the term for the tumor cells releasing chemicals that float downward, and when they hit the blood vessel, those chemicals tell the blood vessel to grow blood, to grow up into the tumor. And this is the same thing that happens in your body whenever you have extra growth. Any cells that need nutrients send signals out. It's a normal part of growth and development. But cancer cells tend to do that a lot and get real good blood growth up into the tumor. Finally, the last word was metastasis. Y'all remember what metastasis meant? To spread into a new area. So cancers will metastasize and spread. Last time I showed you the endoscopy or endoscopy, where they snake the camera up your butt looking for tumors, and bam, they found one right there. So again, that's what you have to look forward to when you get older. Them searching your body for tumors. They don't do it at a young age because cancers usually develop in old people because they're a problem of built-up mutations over a period of time. Sometimes they do happen in young people, and it's kind of tragic when it happens. That's very rare. That's really unlucky. That's a big tumor growing on some guy's head. And that tumor is benign, meaning it's not going to spread. But that's a difficult tumor to remove because it may be growing down into a skull too, and you can't just cut it out because it's attached to the brain. In other parts, it could be. So, some people have to kind of go through life like that. Now, there are all sorts of new surgery, new surgical procedures and such that are getting better at removing tumors like this.
So, if you just cut like half of it off, you'd probably bleed. I'm just saying.
If he cut it off, would it bleed?
You can at least cut half of it.
Oh yeah, maybe you could cut the part that's not invasive. I don't know. Maybe they did surgery on this guy. Maybe not all the time can you cut them off though. And remember, there's a big blood supply going into that, so you can't just go lop it off. You'll bleed to death. They have to go in there surgically and clamp down all the blood vessels and tie them off, and only then can they cut it off. It's a big surgery. This lady had a tongue tumor. That's a big tongue tumor. and she had it removed. Isn't that terrible? Biggest tumor to have been removed intact. The largest tumor ever removed intact by a surgeon was a multicystic mass of the right ovary, weighing 303 pounds. The operation, which took more than 6 hours, was performed by Professor Catherine O'Hanlon of Stanford University Medical Center in California. The growth had a diameter of 3 feet, it's about that big, and was removed in its entirety from the abdomen of an unnamed 34-year-old woman in October 1991. The patient, who weighed 210 pounds after the operation and made a full recovery, left the operating room on a stretcher. The cyst, that's the tumor, left on another. There's the tumor.
Oh my God.
Isn't that a big tumor?
I wish it was still there.
Hold on, let me see what this is.
It may sound like a scene from a science fiction movie, but imagine this. A patient with a cancerous brain tumor that cannot be treated by traditional surgery is led into a room, a robot shoots an invisible beam at the tumor, and the patient walks out 90 minutes later, completely cured.
It's a brand new high-tech brain surgery with no incisions, no blood, and no recovery time. It sounds like a Star Trek movie, all right, but it isn't. This surgery is for real, and here's the amazing story of how they do it. Kelly Zimmerly is a woman with a young son and precious few choices. 2 years ago, she was diagnosed with a deadly form of cancer in her lymph nodes, which she treated with surgery, chemotherapy, and radiation. Although Carla's health improved, another more deadly tumor appeared at the top of her spine. Doctors told her she was facing certain death.
It's terrifying, for one thing, but it's just unbelievably sad to think that, here I finally got my baby and I'm going to have to leave him, so soon.
But Carla is a fighter, and even though her odds look bad, she refuses to give in to the cancer. The tumor is in a precarious position in a sort of surgical no man's land where her spine meets her brain. Carla's radiation oncologist, Dr. Marshall Davis, knows that surgery is extremely risky.
Theoretically, a surgeon can go anywhere, but this is not a spot that they like to go. You can see how it's right underneath the brain. So it's way, way in the back of the throat.
It's almost as inoperable areas as there is in the body.
Carla's only hope lies with Dr. John Adler, who is taking tumor surgery into the future. A respected neurosurgeon at Stanford University, he's at the cutting edge of something called radiosurgery, surgery using radiation.
Basically, with radiosurgery, there's almost no such thing as inoperable. We can go into the most treacherous areas of the brain, and we can eradicate tumors that were previously inoperable.
How's he doing that? By pioneering an ultra-high-tech surgical tool called the CyberKnife. While radiation treatment has been used to treat tumors for years, it takes a shotgun approach, firing repeated doses of radiation over a wide area to kill cancer cells. The CyberKnife is a revolutionary step forward.
Radiosurgery is able to concentrate the radiation at the location of the tumor by using many, many individual beams which all intersect at its common point. And by making the common point the tumor, one can deliver these killing doses of radiation and very little to the surrounding brain. And the results are really quite good because of that.
Incredibly, the CyberKnife makes a 3D map of the human body and then targets just the tumor. How does it do that? First, a CT scan takes a series of pictures to show the tumor from every angle in remarkable detail. The CyberKnife uses this information in conjunction with state-of-the-art robotics to attack the tumor.
Because it uses a robot, it has tremendous flexibility in how it shoots the beam. And we found that we can be even more effective by not cross-firing at the same precise point. And by doing that, we can sculpt out very nicely a shape of radiation that corresponds almost exactly to what the shape of the tumor is.
The closest CyberKnife to Carla is at the Newport Diagnostic Center in Newport Beach, California. She is one of the first patients to undergo this revolutionary procedure. Incredibly, doctors tell her there should be few, if any, side effects from the CyberKnife treatment.
It is mind-boggling, the aspect of not having the sore throat, the soreness, the pain involved with the surgery. That was pretty bad. Even the pain that accompanied the conventional radiation therapy was pretty bad.
This is her only hope. The amazing thing is, an hour and a half after she gets on this bed, she'll get up, walk out, and hopefully never see the effects of this particular tumor again.
Dr. Stafford Chenery is the physicist who controls the CyberKnife treatment. How is it done? First, Carla's doctors feed the CT images of Carla into the computer and highlight the target, the tumor. Next, they plot where the thin beams of radiation will pass through her head, intersecting at the top of her spine. There are 102 beams in all.
We go in and we obliterate the tumor, we zap it with the radiation in actually a more precise way than the surgeon could. After all, a surgeon can only cut what he can see. We, however, can visualize this tumor on a CT scan in 3 dimensions and very carefully tell the robot what to treat. And the robot will go and then treat exactly that and only that.
This is going to be your little head holder, which is going to hold your head.
To keep her from moving too much, Carla wears a head brace and is given a dose of Demerol. It's now time for the CyberKnife to go to work. Amazingly, this is the actual surgery. There's no scalpel, no incision, and no blood. Carla is wide awake and only slightly sedated. In just 90 minutes, she will walk away, her tumor destroyed.
Once a tumor has been killed with radiosurgery, the body's white cells just sort of come like little garbage trucks and sort of take little hunks of the tumor away.
Okay, you want to just sit up? Oh, there she goes.
Carla is one of the lucky few. Just a couple months ago, this phenomenal new medical weapon would not have been an option. She's been given hope where there was none, thanks to the bloodless, painless, and seemingly simple CyberKnife surgery.
The beauty of this procedure is that it is done as an outpatient. The patient comes in at some point, a few days prior to the actual treatment, gets a CAT scan of their head, and then during the treatment itself, they have to lie down on this table for about an hour. After the end of that treatment, they go home. There is no cut in the skull, there's no cut in the skin, no risk of infection. It is remarkable, and it is amazing, and it's, I think, only the start of good, even better things to come.
There was a yellow cat with black spots in his fur. His name was Pickles.
Just a few hours after surgery, Carla is home playing with her son.
The idea of being a first in a treatment that's going to help so many people. There's so many different applications. It really is exciting. I'm going to stick around. And this treatment will help do it.
Now, this technology is so new that there are currently only a handful of hospitals in the entire world that can perform what they call cyber surgery.
If it continues to be as successful as it has been in its early stages of use, the hope is that someday all tumors could be treated this way, which would be an amazing breakthrough. Don't go away.
They just got a CyberKnife machine over at the hospital in Brunswick. Just recently, yeah. Just in the last year or two. And so these things are kind of everywhere, so you can get that done locally. Okay? All right, well, you can stop filming.